My name is Eric McLaughlin. I'm a family medicine physician, and I work as a specialist physician in internal medicine here at Kibuye Hope Hospital, also as a professor for the medical school at Hope African University. AMH has supported Kibuye Hope Hospital over many years in many ways, and the result is that there basically are no parts of what we do here that have not been very significantly helped by the support from AMH. Jason Fader, a general surgeon that has been here at Kibuye Hope Hospital since 2013, was awarded the inaugural Laheim Prize. The effect of that large gift from AMH was a few things. One was to provide substantial funding for the completion of a major surgical ward building.
The surgery ward itself was incredibly helpful. That enabled us to teach better. It enabled us to have all of our patients together, so it was much safer for the patients, much more efficient nursing care. The difference in lighting has been incredible. Before, we couldn't even see the wound or see underneath what we needed to see on a patient, but now with big windows and skylights, we can see all that we need to while rounding, and that has made a huge impact.
Because of that relationship with AMH, things have continued to develop. In 2018, we installed a solar field, which gave the hospital clean, continuous, and reliable power, which really revolutionized the hospital's ability to function.
It has increased our capacity to sterilize, increased our capacity to provide oxygen, and just having constant and consistent power is really a foundation of improving care at any hospital. So whereas before I would have to cancel a whole day of operations because we couldn't sterilize or we couldn't see in the operating room, now we can be sure that whenever we have patients scheduled, that electricity will not be the thing that will stop us from operating on them.
In 2023, AMH helped sponsor the purchase of a number of new laboratory machines, and this has given the ability for Kibuye Hope Hospital to offer lab tests to patients that would otherwise not have access to understanding what their problem is and whether they need surgery, whether they need medical therapy. The tests that we can now offer, many of them are not available anywhere outside of the largest city, which is 3 hours away. In order to meet the needs, not just of today, but for years and even decades to come, we must be training scores of highly capable African healthcare professionals. They are the ones that are going to be meeting these needs in the long term, and even training other generations that will continue after them. AMH's support at Kibuye has enabled us to run a nursing internship program and a physician internship program, which has graduated already dozens and dozens of doctors and nurses and other health professionals that are better trained than they were at graduation, that are now able to go and use those skills throughout different structures in Burundi. We are not the best people for this job. Our students are the best people for this job, and as they grow and we can invest in them, they are becoming better doctors and healthcare providers than we would ever be able to be in this context.